Welcome to our podcast, where we explore essential English words and bring them to life through examples.
We're excited to have you here, ready to deepen your vocabulary knowledge and language skills.
Today, we will discuss the words side effect, disorder, discard, persist, consult, and expiry date. Let us begin with side effect, which is an extra and usually bad effect that a drug has on you.
For instance, a person taking a new medication might experience a side effect, such as drowsiness or an upset stomach.
Some side effect occurrences can be mild, like slight headaches, while others can be severe and require medical attention.
You might read warnings about a possible side effect on the label, indicating the need for caution.
Doctors may reassure you that a certain side effect typically subsides once your body adjusts to the medication.
However, if a side effect persists or worsens, it's important to seek professional advice promptly.
Over-the-counter drugs also carry side effect information, emphasizing responsible usage.
People often check for common side effect listings when considering new supplements or herbal remedies.
Sometimes a side effect can be beneficial, like a medication that also improves skin clarity unexpectedly.
Nevertheless, most side effect mentions focus on negative reactions or complications.
A side effect might vary between individuals, reflecting personal health factors and sensitivities.
Clinical studies aim to identify each potential side effect before a drug is released to the public.
Reading about side effect possibilities helps patients make informed decisions about their treatment.
Doctors usually discuss every side effect that is common or potentially serious at the time of prescription.
Rare side effect cases sometimes emerge only after widespread usage of a medication.
Pharmacovigilance programs monitor side effect reports to ensure ongoing drug safety.
If you experience an unexpected side effect, stopping the medication without consulting a doctor might be risky.
Keeping a log of any side effect can assist healthcare providers in adjusting or changing your prescription.
Next, let us look at disorder, which refers to an illness affecting a part of the body.
A disorder might be physical or mental, ranging from mild to severe in symptoms.
For example, anxiety disorder impacts how a person feels or behaves under stress.
Meanwhile, a digestive disorder could manifest with stomach pain or difficulty processing certain foods.
Doctors study each disorder carefully, determining the best course of action to manage or cure it.
Many people live well with the disorder by following treatment plans and professional guidance.
Sometimes a disorder runs in families, indicating possible genetic factors behind its development.
Proper diagnosis of a disorder often requires blood tests, imaging, or psychological evaluations.
People may not realize they have a disorder if symptoms remain subtle for years.
Early detection of a disorder can improve treatment outcomes and quality of life.
A disorder can affect daily routines, but support groups and therapy often help individuals cope.
Some disorder symptoms overlap with other conditions, making accurate diagnosis crucial.
Media coverage of a certain disorder can raise public awareness and encourage more research funding.
Self-care practices, from diet changes to regular exercise, can alleviate some disorder symptoms.
Managing a disorder sometimes includes medication, therapy, or lifestyle adjustments for symptom control.
Patients who proactively learn about their disorder often feel more empowered and confident.
Supportive family and friends can make a world of difference for someone dealing with a disorder.
Mental health professionals tackle each disorder holistically, recognizing the complex nature of human health.
Let's move on to discard, which means to get rid of something you no longer want or need.
People often discard old clothes or furniture to declutter and create more space at home.
In a medical sense, nurses discard, use syringes safely to prevent contamination or injury.
You might discard expired food items from your fridge to maintain fresh and safe groceries.
Sometimes, you have to discard outdated technology that no longer functions or is incompatible with modern systems.
Many recycling centers exist to help you discard old electronics or hazardous materials responsibly.
A building contractor could discard leftover construction debris to keep a site clean and hazard-free.
In creative projects, artists might discard initial sketches to refine their final work.
If you discard plastic bottles and paper properly, you contribute to a healthier environment.
Housekeeping involves learning when to discard clutter that disrupts comfort and order.
Organizing systems can help decide which items to keep and which to discard.
Some people struggle to discard personal belongings with sentimental value, leading to cluttered spaces.
Businesses may discard outdated strategies and adopt new ones to stay competitive.
In a card game, you might discard certain cards to improve your hand and increase chances of winning.
The notion to discard negativity or limiting beliefs can also apply to self-improvement practices.
Similarly, workplaces discard unproductive procedures to boost efficiency and morale.
Next, let us examine persist, meaning something unpleasant continues to exist or remain.
When symptoms persist despite medication, a doctor might order further tests to uncover underlying issues.
A persistent cough could signal an infection or a disorder that requires extended care.
Feelings of worry or sadness may persist if left unaddressed, emphasizing the importance of mental health support.
Some weather patterns persist for weeks, causing unusual climates like prolonged rainfall.
If a conflict tends to persist, mediation or open dialogue can help both sides reach a resolution.
Stains might persist on clothes if not treated with the right detergent or stain remover.
People who persist in their efforts often succeed, even if faced with repeated obstacles.
Negative rumors or misinformation can persist in the public sphere without fact-checking.
Chronic pain can persist long after an initial injury heals, sometimes becoming a separate condition.
Pollutants may persist in the environment for years, highlighting the need for sustainable solutions.
Old family traditions persist through generations, preserving cultural identity.
If poor communication patterns persist, relationships might deteriorate over time.
Researchers attempt to understand why certain behaviors persist despite awareness of potential harm.
An error message on a computer can persist unless you troubleshoot and resolve the root cause.
Personal goals can persist in someone's mind, driving them to keep striving for accomplishment.
Next, we look at consult, meaning to ask somebody for information or advice.
You might consult a lawyer to clarify legal questions about contracts or property rights.
Patients often consult specialists if their condition requires detailed knowledge in a specific area.
People consult tax experts when dealing with complicated financial regulations or returns.
Students sometimes consult a mentor for guidance on choosing courses or career paths.
Some job applicants consult career counselors to improve resumes and interview skills.
Businesses consult with marketing agencies for insights into reaching new audiences.
Healthcare providers encourage patients to consult pharmacists regarding dosage or drug interactions.
Homeowners consult contractors to evaluate renovation costs and feasibility before starting work.
When uncertain about fitness routines, individuals consult personal trainers for customized workout plans.
Art buyers consult experts or appraisers to verify the authenticity and value of a painting.
In research contexts, scientists consult each other's publications to build on existing data.
If you face a significant life decision, it can be wise to consult trusted friends or family for support.
Even travelers consult local guides or travel blogs to make the most of their time in unfamiliar places.
Finally, let us discuss expiry date, the date after which something should not be used.
Most food packaging lists an expiry date to ensure consumers know when items might become unsafe to eat.
Medications typically include an expiry date on the bottle, indicating when the drug loses effectiveness.
You should check each expiry date regularly and dispose of items past their recommended timeline.
Stores cannot legally sell goods after the expiry date has passed, as it poses health risks.
In some regions, discounts apply to food nearing its expiry date, encouraging quick sales.
Certain products remain usable slightly beyond the expiry date if stored correctly, but caution is advised.
A person might discover old spices past the expiry date, leading them to discard them for safety reasons.
Skincare items also carry an expiry date, after which their formula may degrade or cause skin irritation.
People often forget to check the expiry date on rarely used condiments, risking spoilage in the pantry.
Over time, an expiry date ensures that consumers don't rely on compromised quality or efficacy.
Professional kitchens monitor each expiry date carefully to uphold food safety standards.
In some cases, an expiry date might be extended if the manufacturer's research supports the item's stability.
Always follow your pharmacy's instructions regarding a drug's expiry date to prevent reduced treatment results.
Now that we have introduced each word, let us expand on side effect with more examples.
Combining two drugs without caution might increase the chance of a severe side effect.
Prolonged usage of certain medications could lead to a persistent side effect that necessitates switching treatments.
A label might warn that dizziness is a side effect, advising users not to drive until they know how it affects them.
Some people experience a side effect, like dry mouth, prompting them to drink water more frequently.
Doctors weigh benefit versus side effect risk when considering any new prescription.
For disorder, consider deeper contexts.
Public awareness of a disorder, like depression, can help reduce stigma and encourage individuals to seek help.
Certain diet changes might alleviate symptoms if the disorder relates to nutrient imbalances.
Genetic testing can confirm whether a family member is prone to inheriting a specific disorder.
On discard, let us explore various real-life applications.
Households discard broken appliances responsibly by locating e-waste recycling services.
Workplaces discard confidential documents through shredding to protect sensitive information.
You might discard partial meal remnants if you can't store them safely for later consumption.
For persist, examine broader usage.
Hostile working conditions might persist if management fails to address employee complaints.
Urban legends persist in popular culture, even when evidence disproves their validity.
Hope can persist in tough circumstances, inspiring people to push through adversity.
When we talk about consult, delve into its collocations and importance.
Insurance claims often require policyholders to consult an adjuster to assess damages.
Inventors sometimes consult patent attorneys to protect their intellectual property.
A teacher might advise parents to consult a child psychologist if learning disabilities appear.
Finally, more depth on expiry date.
Perfumes can degrade past their expiry date, altering their scent or causing skin irritation.
Some laundry detergents also feature an expiry date, though many people are unaware of it.
Donating foods near the expiry date might help charities, but only if done safely and promptly.
Now, let us integrate these words into a scenario for practical demonstration.
A patient concerned about a disorder decides to consult a specialist for proper diagnosis.
They discover medication that may carry a specific side effect, so they monitor how symptoms persist or improve.
Realizing an expiry date is coming soon, they double-check all meds to discard anything outdated.
Throughout treatment, they remain vigilant, seeking help if a side effect emerges or a new disorder develops.
In time, if some issues persist, the patient might consult another expert for a second opinion.
Next, consider a second story tying in each word.
A pharmacist explains to a customer how to read an expiry date properly on cough syrup.
The pharmacist warns of a mild side effect, such as drowsiness, if the recommended dose is exceeded.
The customer mentions a history of a breathing disorder, so the pharmacist advises speaking to a physician.
Should any adverse reactions persist, both pharmacist and physician recommend the customer to consult them again.
Later, the customer checks the medicine cabinet to discard outdated lotions and pills.
Each word plays a vital role in real-life decisions, emphasizing knowledge for health and safety.
From side effect awareness to careful observation of an expiry date, these terms empower responsible actions.
Now, let us give numerous additional examples for side effect.
Chemo treatments carry a side effect of hair loss, but it often regrows after therapy ends.
Some users note an unintentional side effect of weight gain or fluid retention with certain hormone treatments.
Over-the-counter cold pills sometimes produce a side effect of dryness in nasal passages.
We extend the context of disorder.
Post-traumatic stress disorder may develop after a frightening event, requiring therapy and support.
Eating disorder conditions range from anorexia to bulimia, necessitating specialized care.
Neurological disorder examples include epilepsy, which can be managed with medication.
More on discard.
Factories discard defective products to maintain quality control.
A library might discard worn-out books to make space for newer titles.
Continuing with persist.
Economic crises can persist when underlying issues remain unresolved by policymakers.
Cultural traditions can persist through adaptation to modern lifestyles, ensuring preservation.
On consult, let us expand usage.
Entrepreneurs consult mentors during startup phases to navigate potential pitfalls.
Farmers consult agricultural experts for advice on pests and crop diseases.
Finally, broadening expiry date scenarios.
Online subscriptions sometimes have an expiry date, ending automatic access to services.
Credit cards feature an expiry date, after which a replacement card is mailed out.
We have now provided substantial insights into each term's meaning and usage.
Next, let's intertwine them in a final comprehensive segment.
An individual with a history of an anxiety disorder decides to try new stress relief pills, verifying the expiry date first.
They notice potential side effect warnings on the label, so they plan to consult their therapist if problems persist.
If the pills yield no improvement, they intend to discard them properly and request an alternative prescription.
This approach ensures they remain vigilant about both the medication's side effect and any interactions with the known disorder.
By staying aware of the expiry date, they avoid using compromised products that might be ineffective or unsafe.
Each word plays a role in this careful, health-centered decision-making process.
Such real-life scenarios illustrate how side effect, disorder, discard, persist, consult, and expiry date interconnect.
Thank you for joining us in this extensive exploration of vocabulary, complete with examples and context.
We trust these discussions about each word's meaning and usage will enhance your English fluency.
Embrace side effect awareness, learn about any disorder that affects you, responsibly discard what you no longer need, and let your goals persist.
Always consult experts for clarity and keep an eye on expiry date to safeguard your health and well-being.
We hope our in-depth approach to these words prepares you for real-life conversations, academic texts, or workplace communication.
Continue practicing them in daily interactions and consider reviewing their collocations for greater fluency.
Join us again for another session where we'll dive even deeper into English vocabulary.
Until then, remain curious, keep learning, and apply these words to strengthen your confidence in English.
Thank you for being part of our podcast, and we look forward to guiding you through more language discoveries soon. Remember that consistent practice helps these words become natural components of your everyday communication.